Are we doing enough to protect our hearts? Nearly 94 million Americans have high cholesterol, a common risk factor for cardiovascular disease. And that's just one of many causes. In fact, cardiovascular disease is the #1 killer of women and men, and your risk may begin to increase once you are over 45. So it's time to rethink your risk for cardiovascular disease. So today, we're going in depth, learning about risk factors, treatment options, and proven therapies. Take a look.
Today, Clarence Chapman is meeting with his cardiologist, Dr. Dharmesh Patel, for his regular 6-month checkup.
Hey, Mr. Chapman.
Hey, Doc.
How are you doing?
Doing fine. Good.
It's been 3 years since Dr. Patel discovered Chapman had an issue with his heart. Until then, this 6'6" former CPA real estate developer had been relatively healthy.
Well, I played basketball through college, ran a lot, stayed healthy. Never got away from the need for a training table, which caught up with me later when I went from 225 to 300. And that, regardless of frame size, is too much to weigh. Over a period of years with intermittent exercise and eating poorly with the wrong type foods, it affected my health to the point that I developed type 2 diabetes about 10 years ago. And progressed from that to having heart disease.
He, like many Americans, needed to put his heart health first.
They found that I had blockage behind my heart in the widowmaker that had to be repaired before they put the pacemaker in, and it was not a candidate for stenting.
Mr. Chapman is a 70-year-old gentleman who really exemplifies the patients that we see in the clinic. Cardiovascular disease is the #1 cause of death globally. So this disease state must be considered seriously. In fact, more people die from cardiovascular disease than many other conditions, including COPD, even cancer, lung infection, diabetes, and even COVID-19. In people aged 45 and older with type 2 diabetes, only half recognize or have discussed the risk for heart disease, attacks, or strokes with their healthcare provider. Mr. Chapman ultimately ended up having 4-vessel open heart surgery. During that procedure, due to electrical disturbances of the heart, he actually had a pacemaker too. He is diabetic, as we all are aware. Adults with diabetes are twice as likely to have a heart attack or stroke.
But Dr. Patel basically treats me like he would his own father. He pays particular attention to all of my blood work, my charts, how I'm doing, how I'm progressing, even interviews my wife to make sure I'm telling him the truth, so keeps me straight with that. The 1st of January this year, my wife Jane and I converted to the vegan diet with fish and seafood. And I've lost 15, 16 pounds. Jane has lost some weight, which surprised her. Her cholesterol dropped 40 points. I'm already off 1 cholesterol pill and half my diabetes medicine, and expect to get off more in the months that come as we stick with it.
Diet and lifestyle modifications are very important in cardiovascular disease. One of the cornerstones in the treatment of cardiovascular disease are statins. Statins reduce the progression of atherosclerosis and plaque formation in the heart and many other vessels in the body. And yes, they do further reduce the risk of cardiovascular heart attacks and stroke. 25 to 30% is how much statins reduce your odds of a life-threatening cardiovascular event. Statins, along with diet and exercise, are the first step, but they don't fully protect you from a serious heart attack or stroke.
Vascepa is a prescription medicine used along with certain medicines, statins, to reduce the risk of heart attack, stroke, and certain types of heart issues requiring hospitalization in adults with heart cardiovascular disease or diabetes and 2 or more additional risk factors for heart disease. Do not take Vascepa if you're allergic to icosapent ethyl or any of the ingredients in Vascepa.
Vascepa may cause serious side effects, including heart rhythm problems, atrial fibrillation, and atrial flutter. Heart rhythm problems, which can be serious and cause hospitalization hospitalization have happened in people who take Vasipa, especially in people who have heart cardiovascular disease or diabetes with a risk factor for heart cardiovascular disease, or who have had heart rhythm problems in the past. Tell your doctor if you get any symptoms of heart rhythm problems, such as feeling as if your heart is beating fast and irregular, lightheadedness, dizziness, shortness of breath, chest discomfort, or you faint. Possible allergic reactions if you're allergic to fish or shellfish. Stop taking Vasipa and tell your doctor right away, or get emergency medical help if you have any signs or symptoms of an allergic reaction. Bleeding. Serious bleeding can happen in people who take Vasipa. Your risk of bleeding may increase if you're also taking a blood thinner medicine.
Please see complete important safety information at the end of this video.
After surgery, talked with Dr. Patel, and he decided that I needed to take Vasipa. Dr. Patel and I discussed the risk and the benefits and decided that it was a good option for me.
After discussing the potential risks and benefits with Mr. Chapman, we decided that Vasipa would be an appropriate option. It's important for individuals to talk with their healthcare providers, as results may vary and everyone's experience is different. When Vasipa was added to a statin in his case, it has been clinically proven to produce another 25% reduction of heart attack and stroke, even patients who have a family history. So this is the reason we thought that Vasipa was a good therapy for Mr. Chapman. It's a pure, stable therapy called isopentyl ethyl, which is an inactive form of EPA. Now, EPA sounds familiar because it's an omega-3 fatty acid. IPE is the only active ingredient in Vasipa and is considered the reason behind the significant cardiovascular benefits Vasipa can deliver. This is why I think Vasipa is so important. It was done in a controlled, FDA-approved manner where it showed improvement or reduction in cardiovascular stroke and heart attacks. This is why, as the cardiovascular arena, we have welcomed Vasipa into our armamentarium to further reduce events in patients who have cardiovascular disease.
Through his lifestyle changes, daily statin, and Vasipa, Chapman continues to do well.
So now Mr. Chapman, 2 years later, comes to see me every 6 months in the clinic. I have to say, I am truly pleased with his progress.
You've got to be part of the solution because you've got to commit yourself to eating properly and to exercising consistently with aerobic and weight-resistant training. And it's all a part of staying healthy and taking care of your body.
Well, we're looking forward to some travel and getting around. We have 11 grandchildren together, and from 17 down to 3. And so just getting around to visit and see all of them is, we enjoy that.
And that's the beauty of medicine. It's an art. We work together in trying to individualize the appropriate therapy for the appropriate patient in the appropriate disease state.
If you'd like to learn more, go to Vasipa.com. Important safety information to follow. You can always go to our website, thebalancingAct.com. We'll be right back.